Am I audible? Okay, good morning. In this session, we are going to discuss about the clinical importance of your mammary gland. Okay, so what are all the topics covered under the heading mammary gland? Location, extent, structure of mammary gland, all these topics are discussed or not? Yes. So, what you all learned in the location, where we can find the mammary gland? Okay, what about the extent? Extension of your mammary gland? Vertical extension, horizontal extension. What about the structure? What are the headings you have seen under the structure? Skin, fascia, and fat, stroma, and parenchyma. Mammary gland is an important 10 marks question. Okay, note it down. You have to write the location first, then the extension, followed by structure of mammary gland. Then you have to mention about the blood supply, nerve supply, and then 1 or 2 clinical points for 10 marks with 1 or 2 diagrams. One for structure and one for blood supply. And again, lymphatic drainage of mammary gland is a separate short answer question. Sometimes it will be asked for 5 marks, sometimes for 3 marks. If it is for 5 marks, you have to write diagram and some content. If it is for 3 marks, go for content and flow chart. No need to draw the diagram for 3 marks. Okay, these are the 2 important questions you will get in your mammary gland. I'll give small introduction for blood supply, nerve supply and lymphatic drainage. Then I'll discuss about the clinical importance. Okay. So how many quadrants are there in your mammary gland? How do we divide the mammary gland? On what basis? How many quadrants are there? So for division of the quadrants, you have to draw this diagram. Okay, this is called medial side and this is called the lateral side. On the medial side, we have the thorax region and on the lateral side, we have the axilla region. Okay, and this will be your nipple and areola part. What is this structure called? This structure is called as the axillary tail of Spence. Okay, it is a part of mammary gland which extends up to your axilla region in a tile structure or in the tile shape. So it is named as axillary tail of Spence. Okay, so now this entire mammary gland can be divided into 4 quadrants. Like this. Okay, so for the study of your blood supply, nerve supply and also lymph, you have to draw this particular diagram. The another one what sir has showed, no, that is for structure of the mammary gland. Okay, remember this point. So these 4 quadrants are named as upper medial quadrant and this is upper lateral quadrant. This is lower medial quadrant and this is called lower lateral quadrant. These are the 4 quadrants you should remember. Okay. We'll see the blood supply of your mammary gland. Your mammary gland is a highly vascular structure. It is totally supplied by 5 arteries. Any idea which arteries? It is a highly vascular structure and it is supplied mainly by 5 arteries. We'll start from the medial side. Here, imagine we have the internal thoracic artery. Since this is the thorax side, I am just going to draw a diagram of your internal thoracic artery. Okay. There are branches from the internal thoracic arteries which supplies to your mammary gland like this. and these branches are called perforating branches. Perforating branches. Perforate means small. Okay, these are referred as small branches from the internal thoracic artery which supplies to your mammary gland. Okay, on the axilla side we will get the axillary artery. So now imagine this is the axillary artery. Okay, so this axillary artery is a branch of which artery? This is your axillary artery, which is a branch of subclavian artery. Above the clavicle it is called as, now imagine we have clavicle here. Above the clavicle this is called as subclavian artery. Below the clavicle this is mentioned as axillary artery. Your axillary artery have three parts: first part, second part and third part. Okay, it will be discussed in detail when we are taking the axilla classes, but right now I am going to mention about two important points. Your axilla has three parts: first part, second part and third part, and each part have branches. Your first part have only one branch, second part have two branches and third part have three branches. Remember these two basic points about axillary artery. Okay, so now this will be the first part, this is the second part and this is the third part. Okay, from the first part we have only one branch, that is called what is this branch is called? Superior axillary artery. Superior axillary artery. Okay. From the second part we have two branches which supplies to your mammary gland. Okay, this one is called thoracoacromial artery. Thoracoacromial artery. Acromial artery. Okay, and this branch is called lateral axillary branch of axillary artery. This is lateral branch. Okay, so these are the four arteries. This is the first one, second one, third one and fourth one. Okay, the another one artery is from the intercostal artery, again lateral branches. Okay, intercostal arteries can be seen in this area, like this. Okay, so these are the 5 arteries that supplies to your mammary gland. I'll give introduction only for the arterial supply and for the limb. It will be discussed in detail by your Shantanu sir once again. Okay. So right now remember your entire mammary gland is a highly vascular structure. It is mainly supplied by 5 branches. The very first branch is perforating branches of your internal thoracic artery, then 3 branches from the axillary artery. The first one is superior axillary artery, second one is thoracoacromial artery and the third one is lateral branches, and the last branch is intercostal arteries, lateral branches of intercostal arteries. Okay. Acromiothoracic, that is nothing but your thoracoacromial branch which I mentioned. These 3 are the branches of your axillary artery, and the last one is lateral branches of the posterior intercostal arteries. These are the 5 branches which supplies to your mammary gland. Okay. So here is the diagram which I have explained. This is from the textbook. Don't forget to mention about the quadrants. First mention about the quadrants, then show the arteries while writing in exams. Okay. Next one. The veins follow the arteries. They first converge towards the base of the nipple where they form an anastomotic venous circle from where veins run in superficial and deep sets. So the venous drainage takes place in two sets. One will be the superficial set and another will be the deep set. The superficial veins drain into the internal thoracic vein and into the superficial veins of the lower part of your neck region, and the deep veins drain into the axillary and posterior intercostal veins. If you remember the artery's name, it will be easy to write the veins name also. So the superficial veins will drain into your internal thoracic veins part and also to the lower part of your neck region, whereas your deep veins will drain into the axillary vein and also to your intercostal artery veins, intercostal vein part, posterior intercostal veins. Okay. So your nerve supply will be supplied by the anterior and lateral cutaneous branches of the 4th and 6th intercostal nerves. Okay, and the nerves convey sensory fibers to the skin and autonomic fibers to the smooth muscles. What do you mean by sensory fibers? Do you know the difference between sensory fibers and autonomic fibers? Motor fibers are also there, sensory fibers are there, autonomic fibers are there. Fine, if you can replay something or interact, I can continue, otherwise I am just going to read with the slides. So remember, the nerves does not have any connection to the lactation part. Once they start the lactation part, you will understand. Right now, try to remember these 2 points. The nerves do not control the secretion of milk. Secretion is completely controlled by the hormonal part. Okay. The next one is lymphatic drainage. Lymphatic drainage, again you have to learn in the quadrat plant part only. So what are the important lymph nodes we can see in this region? Okay, now just imagine this has the body region only. Okay, this will be the thoracic region and this will be the axilla region and this is your arm. Okay, and this is the axilla region. Your mammary gland is mainly drained by 2 lymphatic node parts. Okay, the first one is axilla node, axillary lymph node. It contributes around 75% and the another one is mammary lymph nodes. It will contribute around 20% and there are certain other lymph nodes which contributes around 5%. Okay, knowing about the lymphatic drainage of your mammary gland is very important because this is related to your clinical anatomy part. This is how you are going to learn how the carcinoma cells in the breast will spread from your breast region to your pelvis region. Okay, so you should know the pathway of lymphatic drainage in your mammary gland. So your axillary lymph node have 5 sets. Okay, stop talking. Your axillary lymph node have total 5 sets. Okay, here we can find 1 set. Okay, and in this region we can find 1 set and also in this region we can find 1 set. Okay, this is called anterior lymph node and this is called posterior lymph node and this is called lateral lymph node. Okay, from the breast, the lymph will drain first into anterior, posterior and lateral. From these 3 lymph nodes, it will drain into one more lymph node that is called central lymph node. After the central lymph node, it will drain into your apical lymph nodes. So these are the 5 lymph nodes that comes in your axillary region: apical, central, posterior, lateral and anterior sets of lymph nodes. Okay, all these will drain towards your subclavian part. Okay, remember this. And the memory lymph node can be seen in the thoracic region here, like this. This will contribute around 20%. And the another lymph nodes are posterior intercostal part lymph node, where we can see in this region it will contribute around 5%. Okay. So mainly we have axillary lymph node, and your axillary lymph node have 5 sets: apical, central, lateral, posterior and anterior. From the breast, first it will drain into your anterior, posterior and lateral part, or to the lateral sets. That set will drain into the central lymph node, and again that set will drain into the apical part, then it will go in your subclavian region. Okay. Towards the thoracic region, we have memory lymph nodes. Lymphatic drainage of the breast assumes great importance to the surgeon because of the carcinoma of the breast spreads mostly along the lymphatics to the regional lymph nodes. The subject can be described under 2 headings: the lymph nodes and the lymphatics. So, what is the difference between lymph nodes and lymphatics? What is the difference between lymph nodes and lymphatics? Lymph from the breast drain into the following lymph nodes. The very first one is axillary lymph node, chiefly the anterior group. The posterior, lateral, central and apical groups of nodes also receive lymph from the breast, either directly or sometimes indirectly. The internal memory nodes which lie along the internal thoracic vessels here in this region. Here only we have seen the internal thoracic artery, so the lymph node will also stay along with your internal thoracic vessels only. Some other lymph node which I said contribute around 5%, those are supraclavicular nodes, the cephalic node, the posterior intercostal nodes, the subdiaphragmatic nodes and the subperitoneal lymph plexus. Okay, so these are the lymph nodes you should remember and mention in your answer sheets. So here is the diagram which I have tried to show here. You can check the lymph nodes. First check the axillary part, where I have mentioned the anterior, posterior, lateral. Then it will drain into the central lymph node, from the central lymph node to the apical lymph node. This is the central one. From here to the apical, from apical it will move to the supraclavicular nodes, which I said in the supraclavicular region it will move. Okay, and this side you can see the memory nodes, which is present along with your internal memory vessels. Pectoral, dectopectoral node. हाँ. It will come in memory lymph nodes or? No, it's a separate one. Deltopectoral part is there, no? That comes between your deltoid region and pectoral region. Can you see here? It is almost given in your shoulder region, where you can feel the deltoid muscle. In the posterior aspect, right? In the anterior aspect, we can see the pectoralis muscles. So it will come between your shoulder region. It is a separate node. It doesn't come under either in the axillary lymph node or in the memory lymph node. It's a separate one. Yeah, others one. Finished? Okay, clinical anatomy. Start reading the clinical anatomy.
Clinical anatomy. The upper and outer quadrant of breast is frequent site of carcinoma cancer. Several anatomical facts are of importance in diagnosis and treatment of this condition. Abscess may also form in the breast and may require drainage. The following facts are Rothio notes. Incisions of breast are usually made radially to avoid cutting the lacteferous duct. Cancer cell may infiltrate the suspensory ligaments.
Okay. The upper and outer quadrant of breast is a frequent site of carcinoma. What is the reason? The upper and outer means your lateral quadrant, upper lateral quadrant. Why? What is the reason? Because that particular quadrant is closer to your axilla part, and in the axilla part we have the 75% of lymph node contribution. So that particular quadrant is most easy to get affected by your breast cells. Okay, that is the reason. And several anatomical facts are of importance. Okay, abscess may also form in the breast. What do you mean by abscess? Cavity. Okay. Any other answers? Abscess are usually the swallowed region which is very painful and also filled with pus. Okay. That particular part is called as the abscess. So in case of carcinoma, there are chances of seeing abscess in your breast region. Next, we have some following worthy points. Those are: incision of breasts are usually made radially. What do you mean by radial incision? Incision classes are finished, right? What do you mean by radial incision? How the radial incision is done? Can you see this diagram? See this point, radial incision. This is how the radial incision, that means in the cross manner. Okay, that is how the radial incision is done, like this. Cancer cells may infiltrate the suspensory ligament. What is suspensory ligament of Cooper? Suspensory ligament of Cooper, or just a suspensory ligament. Structure of mammary gland is finished or not? Because none of you is responding for any question, so I'm getting doubt whether you have understanding or not. Is there any problem with the topic? You can discuss. Is it difficult to understand? Do we have to make any changes in the teaching? Suspensory ligaments are a type of ligament which is also called as suspensory ligament of Cooper, which is present in the deeper aspect of your mammary gland, which helps to keep the mammary gland in the proper position. Okay, basically it will support your mammary gland to be in the proper position or in the particular location. Those ligaments are named as suspensory ligament of Cooper. These points are all discussed in the structure only. Okay. So, cancer cells may infiltrate the suspensory ligament. So, there are chances your cancer cell may infiltrate. What do you mean by infiltrate? Enter. It's nothing but enter. So, your cancer cells will also enter into the deeper aspect of your mammary gland and affect the suspensory ligament. So, where the position of your breast will also change. Okay. Next. Once the puckering of skin part takes place, this is how the breast will start appearing. You can see the difference, right? So there is change in the position also, and there is the folding of your skin also. The second point is obstruction of superficial lymph vessels by cancer cell may produce edema of the skin. What do you mean by edema of the skin? Swelling. Okay. Any other answers? Inflammation. Very good. So there will be an inflammation in the skin along with the change of color of your skin. Usually that affected part will start appearing either in red or in orange color. Okay. So once your breast gets affected, this is how it will appear. You can see the normal one or the unaffected one and the affected one. Okay. So this condition is called as POOJA orange appearance. POOJA orange appearance. Okay. Because of the communication of superficial lymphatics, remember your lymphatics will drain in two sets, one deeper set and another one is superficial set. So due to the communication of superficial cell, the cancer cells may spread from one side to the other side of the breast. And there are chances where your lymph vessels will travel from the pectoral region to the abdomen region and affect your liver, and next it will also spread up to your pelvic region. Okay. Once you get to know about the flow chart of your lymphatic drainage, you will understand this point. Okay. Right now, remember your cancerous cells or affected cells can travel from the pectoral region to the abdominal region and also to your pelvis region. Remember this point. Okay. So here is the diagram. First, try to observe the mammary gland, then only the axillary lymph nodes and the mammary lymph nodes, which I have mentioned. Later, you can see it traveling to your abdomen region and affecting your liver, then lower the pelvis region and affecting your ovary part also. So first, when a person or a patient thinks that she might have affected with the breast cancers, she can do some self-examinations. Okay, this is what even doctor will tell. So I have added few points, you can read it out. Okay, so when a person or a patient is doing a self-examination, the first thing they have to observe is whether the both mammary glands are in symmetry or not, including the nipple region. Okay. Then they have to check, is there any changes in the color or appearance of your breast, which I mentioned as edema of the skin part. Then they have to check the retraction of nipple is also a sign of cancer. I have already shown the picture here. If there is any such retraction or folding in the skin, it will confirm that the person is having a breast cancer. Okay. Sometimes there are chances of seeing a transparent or white discharge from your breast when we squeeze it. That is also a sign of cancer, followed by palpable lumps. So what happens is doctor will ask a patient to check through the palm. Okay, so we have to check each and every quadrant. You have to press, you have to rub it in the circular aspect and have to check, can you feel any plum or any lump like appearance is there or not, like that. Okay, then mammogram will reveal the cancerous mass. So you can see here, this is the carcinoma or the cancerous cells present in your breast region. Okay, and these are the diagrams or picture for the self-examination of the breast. First picture is showing the palpable structures can be checked or not. The second picture is showing to lift both the arms and feel any lymph nodes are present in the axilla region. And the third one is the person have to sleep in the posterior aspect and have to move like up and down or in the zigzag manner. And they can check whether they have any lumps or not in the breast region. They can feel any lumps or not in the breast region. Okay. So I have added one more picture. This is more like an assignment picture. Just try to take a picture or remember the picture and identify what is this condition or what is this procedure. Any idea about this? Okay, to remove the fluid. Okay, your friend is telling it is a test that we conduct where we will take the fluid or any tissue cells from the breast to examine. Any particular name for that? Biopsy. Okay, biopsy of mammary gland or breast. This one slide I'll discuss in detail in my next class. Before that, all of you go and check for this. Okay. Any doubts? In your textbook for clinical anatomy of mammary gland, they have mentioned only about the carcinoma of breast cells. So I have added only that part. If you know any other thing, you can discuss. Any doubts? Any doubts in blood supply, lymph nodes or in the clinical anatomy? No doubts? Yes or no? At least, do you guys understood anything from this class? What is? What is mammogram? What is mammogram, guys? I will let them answer, I'll discuss. What do you mean by mammogram? You have seen the picture, right? What do you think this is? Screening of mammary gland. Okay. Any other answers? X-ray. X-ray of mammary gland. Okay. X-ray of the mammary gland. Yeah, used to detect the cancerous cell in the mammary gland. Okay. Any other answers? Mammogram is generally the X-ray of your mammary gland to check your cancerous cell presence or not. Okay. So, but through this only it will not confirm. Again, they will take mainly the tissues or cells from your mammary gland, then do the pathological test to confirm the cancer. Okay. That's how the breast cancer will be confirmed, not only through the X-ray. Any doubts? No doubts? Okay, fine. Thank you.